So let us begin with Ellen's keynote study streak. Today we'll discuss a remedy which is in connection with the remedy we discussed in the last session, which is hydrostasis. Today we'll discuss a similar remedy which has profuse catarrhal discharges, and it is indicated mostly in such conditions where there are ropey stringy discharges. The remedy we'll discuss today is crocus sativus. So crocus sativus is something like catarrhal remedy which has features of ignatia, or something that is deep, a combination of ignatia and pulsatilla. That is what will lead you to prescribe crocus sativus. I remember a very interesting case of crocus sativus, and I'll share once we come to an end of this session. So if you are there till the end of this session, you will get to know how interestingly we can pick up two, three different components of Allen's keynotes for a remedy and prescribe certain remedies which we never come across in normal routine thoughts or normal routine practice. So crocus sativus, it is named as saffron, and if we go and read the first keynote which is mentioned, frequent and extreme changes in sensations, sudden changes from great hilarity to the deepest despondency, and the two remedies mentioned in the bracket are ignatia and nux moschata. If you have seen some people or some females who are more or less very much changeable in nature, at one moment they are laughing and at the other very moment they are very much sad, and this is a very subtle observation. It's not something that is very obvious. They'll be silent, they will not respond, they will kind of go inside themselves and brood, and that is what should lead us to think about crocus sativus for prescribing. So then you have is excessively happy, affectionate, wants to kiss everybody, the next moment he is in rage. So at one moment they are very much happy, they are very much affectionate, they are very much uh, restless in nature, want to kiss everyone, but at the very next moment they are in a rage, they are in a fit of anger, they are very much angry at the opposite person. So that would be crocus sativus for you. They will be changeable in their nature. In fact, there is a very nice rubric of crocus sativus. You will see alternating states. It is there as one of the remedies present in many of the rubrics of alternating states. It can be mood changeable, it can be anger alternating with all the other sub rubrics that you see in repertory. So crocus sativus is one of those remedies that you should think of in people who are very much lovely, kind, and affectionate in the first few moments of their meeting, or in one phase of their life, and at the another phase they are very much opposite, angry, snappish, they can even hit the opposite person or harm the opposite person. And that's why we have the relationship ignatia and nux moschata on the mental level, which is very strong. Physical generals we cover. The first thing is hemorrhage from any part. Blood is black, viscid, clotted, forming into long black strings hanging from the bleeding surfaces like the remedy elapse. So any case that is especially the blood is coagulated too soon, the females who have menses, but the menstrual blood can be drawn in thick ropey strings, they will definitely tell you by themselves as a subjective symptom. That is where you should think of crocus sativus. During climacteric, this is a very good remedy on par with ustilago. We have very frequently prescribed ustilago. In fact, we prescribe sulfur, sepia, graphitis, and natramur most of the cases of climacteric, but we tend to omit crocus sativus, ustilago, and these smaller remedies which should be given like intermittently in between of the chronic treatment, so the patient will feel better in that situation. Headache during climacteric, throbbing, pulsating headache, which is aggravated every 2 or 3 days of accustomed menstrual flow. and nervous or menstrual headache before, during, or after flow. So all those cases who have accompanying headache with their menstrual flow, you should think of crocus sativus as one of the strong remedies. Lachesis, Lilium tigrinum, and Cor are the other three remedies vying for attention whenever a patient complains of headache and menses which occur during or before the headache symptoms. Next you have is ice, the sensation as if room were filled with smoke, and this is a very vague sensation. Not many times you will experience or get the patient tell that, but as if he had been weeping. So there is a lot of lacrimation also, or they feel that there is some sensation in the eyes which disturbs their vision, as if a cold wind is blowing across the eyes and closing the lids tightly give them some sort of relief. Next you have is again hemorrhage or nosebleed in crocus, which is again black, stringy, tenacious, and every drop can be turned into thread. So fast is the coagulation in crocus sativus. In fact, in such cases, these symptoms, the epistaxis, the nosebleed can turn as a concomitant symptom for you to think in cases of heart problems, in cases of GI troubles, deep-seated chronic cases. You have this patient also complaining of cold sweat in large drops on the forehead, and also in children who develop too rapidly, like too fast. Their growth and their physiology does not match sometimes with the body age. That is where you should think of crocus sativus. Calcarea carb, and phosphorus are the other two remedies we should think of also in such cases. So next you have is in the nervous system, chorea, hysteria with great hilarity, singing, dancing like the remedy tarantula, alternating with melancholy and rage. So all those cases who are bordering on insanity, they are in bipolar disorders, they are in psychiatric, troubles. They are already on some medicines. Those cases when they are weaned off the troubles of their allopathic medicines, psychiatric medicines, they should be given these medicines, crocus sativus, ignatia, belladonna, hyoscyamus, stramonium, intercurrently, so that their mental uh, state is stabilized in a way, and you can give them a relief on the mental sphere for that moment and continue with the constitutional treatment further down the line as the treatment goes. Spasmodic contractions and twitchings of single sets of muscles. So we already saw that this phenomena is there in zincum, it is there in ignatia, it is there in agaricus, and similar presence we see in crocus sativa. So it is almost like a remedy which is like ignatia but having lot of qatar which can be drawn into long threads, which should be thought of crocus sativus to prescribe. Next you have is dysmenorrhea. Flow is black, stringy, clotted, ustilago, and sensation as if something alive in the stomach or abdomen or uterus or other parts of the body. We have the remedies sabadilla, thuja, and sulfur, very similar, giving you these presentations. At times, patients do complain of these sensations. There will be nausea and faintness with these complaints anytime they will share. One interesting case that I remember and from my practice for prescribing crocus was a lady who entered was laughing at the moment she entered the clinic. She sat down, she detailed her complaints that she has lot of menstrual trouble, her age is 45, the bleeding doesn't stop for 7 days, 20 days, and it is like lot of clotted blood is there, and she was laughing intermittently. What to tell you about these troubles? I feel so shy about telling these troubles to a you know male person, but since you are the only person over here, so I cannot tell to anyone. And she kept on laughing, intermittently, as if she is telling a joke and laughing. And then when I came to her mental history, I asked about her anxieties, anger. She became very much withdrawn. She was not willing to answer. Nothing I would like to tell you. There is nothing as such I want to convey. That is the alternating state of crocus sativus. Climateric age, blood clots which are going through the menstrual flow, that will prescribe you crocus sativus. 30 TDS I gave, and in a month she was all right. her menstrual irregularities were also all set. That is the subtle observations that you will need to do in your clinic. So we come to the relationship. Nux vomica, pulsatilla or sulfur are to be given after crocus sativus to complete the cure. We should know the remedies which follow the previous remedy so that we can complete the cure. Sometimes the only medicine cannot help complete the entire cure. And one of the top remedies that we should compare in such cases of menstrual troubles should be Ustilago. So next we'll study Ustilago, which is tomorrow around 5:15. Stay tuned on the Instagram or YouTube or whichever portal you are watching this, and you will get to know something about Ustilago. A lot of details are there, but we'll pick up just the few important ones and describe them further.